Happy Pharmacy Week.
Yeah, happy Pharmacy Week. This is our second video here, wishing pharmacy a happy Pharmacy Week and the organization happy Pharmacy Week.
Absolutely.
What I'd like to try to do here, Mandy, is kind of go through our last year and some of our organizational and pharmacy successes. The things that come to mind right away is the opening of the second pharmacy, the Ready Scripts Pharmacy, over in
Ocean Pines.
Ocean Pines.
Yeah, absolutely. It was really proud of the team, the leadership across the board. Of course, with you, James, Jeff Kukul, Karen, Biella. Really great leadership. We had an awesome, successful opening. Very proud to be able to do that for our community. And we're seeing right out of the gate, just community engagement, use of the service, providing a better level of service to our community just by being geographically located in a place that is, easy for our customer base, our community base. Of course, we have the great drive-through, which is awesome. So just a really tremendous project implementation, and very proud of the work by the pharmacy team there.
Yeah, and what we have there is a co-location with some of our primary care providers and peds providers. I think will offer incredible service back to your comment to our community and service to our providers. We also have the MTM program co-located there.
Yes.
With Jordan leading that program this year and providing support to our providers and our patients.
Yes, the MTM program, very important for not just our community, but our safety. We talk a lot about safe, quality patient care. So when we talk about MTM, it stands for Medication Therapeutic Management, and it allows our retail pharmacy the opportunity to help patients that may have a lot of medications, or providers that are trying to fine tune some of the chronic disease management medications, or even just getting compliance packets out to patients to make sure they're help with taking those meds at the right time and they don't get confused. One of the other things I would mention about Ready Scripts is just amazing customer service across the board. Whether I walk into the pharmacy downstairs or I walk over to Ocean Pines, you're always greeted with a smile. Every place I go that I talk to a community member and we talk about Ready Scripts Pharmacy, you just hear about unsurpassed customer service. So it's incredibly proud of our Ready Scripts team.
And that customer service is in contrast to the kind of current state of not just community pharmacy, but national pharmacy. It's one of those kind of skills that I think large retail pharmacies have forgotten, and clearly an advantage. If you're reaching toward the patient or leaning in, as you say, the patient's more in a position to share side effects and those types of things. So I consider that actually a patient safety feature, just up front. Sometimes when we're talking about pharmacy, even though there's not a direct reporting relationship, but we would be remiss if we didn't speak to the fact that the diabetes educator, Nikita, is also co-located in that building and providing diabetes support to our patients, and both in the clinic, she has clinic patients, but also on consultation, she comes and reviews some of the tough diabetic situations in the inpatient setting. And I think this year we're kind of in a much better place to help and support our patients who are diabetics. So I think
yes, absolutely. We're so thrilled to have Nikita with us, definitely complementing our pharmacist expertise that we have in-house. Board certified in the diabetes space, just incredible expertise, and again, another benefit to our community.
Right. That leads me on, since we're beginning to talk about specialty pharmacists, is to begin to speak of the work that Anna has been doing in antibiotic stewardship.
Yes.
We have a major challenge there. I think Anna's supporting our organization mission there to reduce our antibiotic utilization in cooperation with the medical staff.
Absolutely. Anna comes with a passion that I am not sure I've ever seen, really driven to improve antibiotic stewardship. She lives it, she breathes it, she really works respectfully with her peers, whether it's in the hospital, even some in extension into the community with Dr. Castaneda. But again, she brings much subject matter expertise, which is important to us, and is able to really move the needle in improving our outcomes for our patients, because that's why we're here, to take care of our patients, provide great, safe care. And we've seen exceptional results this past year with Anna's leadership in reducing our antibiotics, which reduces hospital-acquired infections, reduces length of stay, which we're seeing reductions in all of those spaces, and incredibly proud of the work that Anna's been doing with antibiotic stewardship.
Right. And as we go back, we have to call out, in collaboration, the C. diff rate. With Anna's support, our infection prevention team, the physicians, we've managed to get our C. diff rate to almost zero.
Yes, greater than 4 months currently, C. diff free, exceptional. We coming off of fiscal year 23, we had 20 C. diff infections, and I think we're now sitting, and that's hospital acquired, and we're sitting with zero for over 4 months. Really shows the hardwiring of best practices, and one of those being the antibiotic stewardship work.
Right. Incredible work to that entire team. I want to kind of switch a little bit here and spend a little time talking about the inpatient pharmacy team, led by Michael. I think Michael's done a great job, as Michael has begun to shoulder more and more the accountability and responsibility for the inpatient team. Both the pharmacists and the technicians, I think they found their rhythm last year. They've helped support some of our strategies and goals in terms of reducing costs, identifying redundant medications that perhaps really don't need to be on our shelf. They've had a great time reducing our costs there. I kind of gone back and looked at the dollars, and perhaps if my calculations are correct, we may have reduced our against budget, our spending in the area of greater than $300,000 beyond our target, which is just, and I need to add, without complaints, which is really challenging because we want our medical staff to have the tools they need to service our patients. So yeah. I think that's something we just need to call out. He's implemented a number of programs to support him reaching that goal. One being the logistics program, which is a perpetual inventory system that we've used both in the inpatient setting, and now we've implemented that in the cancer center. It gives us eyes on in terms of what we have on our shelf, days on hand, and the number of turns, which are all important kind of metrics from the operational perspective of the pharmacy.
Yeah, Michael's done an awesome job this year doing all the things with cost reductions, inventory management. Really proud of the work that he's done in leading the inpatient pharmacy group. And, he's also really building a fantastic team within the inpatient pharmacy world. We talk a lot about nurturing a strong workforce. We're talking about all these exceptional pharmacists that are really experts in their space. And continuing to grow. And I would take that the next level. We have a lot of pharmacy techs that are in the space of the inpatient pharmacy that continue to grow themselves, whether it's on the career ladder. I know we've had 6 of our 8 full-time techs hop on our advanced career ladder, which is exceptional. We always try to continue to support our team, grow our team, add bandwidth and bench strength to our team. And the pharmacy techs need to be called out as well as we're thinking about Pharmacy Week. And, again, back to Michael, he's leading this team in continuing to grow bench strength to help support the safety of the care that we provide, with various roles.
Yeah, and 2 areas I want to call out in terms of the pharmacy tech growth. Again, the 6 of 8 technicians have started going through the career ladder. One of the areas that the vast majority of these technicians have gotten additional certification in is medication history. Mm-hmm. And that is becoming critical to our patient safety, It is a upfront piece for our providers in terms of when they meet our patients for the first time. Pharmacy is getting out through the technicians, reviewing the patient's medication histories, updating those histories and putting them in a place in our system so that the physicians can review and, as appropriate, order new medications based on that, which is really critical to our safe medication management strategies there. There's some of the other kinds of things that our technicians have done is I just want to make a call out to Kelly Klein. Kelly is outstanding, an outstanding technician. She serves as our purchasing technician, but in ways she's also one of the first technicians we have in our organization to receive the advanced certification. She was also selected this year to sit on the board of the Maryland Pharmacy Association, which is an extraordinary honor.
Truly, it's impressive. AGH is lucky to have Kelly sitting as part of this role, and just incredible results from our local AGH team.
Yeah, and she also was selected as from a purchasing tech position as the second best tech in the nation.
Wow.
So that's just our technicians, and the career ladder we're extending this year to our pharmacists.
Yes.
So we'd like to have the same level of engagement, same level of opportunity for our pharmacists in terms of the career ladder.
Absolutely, and I'm looking forward to seeing some of the great projects, quality improvement work that's going to come out of this group in the next year as more pharmacists hop on the career ladder.
With that, we want to say basically
Happy Pharmacy Week.
Happy Pharmacy Week.
Yeah, thank you all for all you do. I will say I never talk to somebody in the pharmacy here at AGH that is not absolutely leaned into their work. And when you care about what you do, it really makes doing what you do a lot easier, and working together as a team. So again, just thank you all for everything that you do outside of your locked doors and inside those locked doors. And I appreciate James for your exceptional leadership and our partnership as we continue to drive great quality care in our community.
Yeah. Again, thank you, Mandy. We appreciate your leadership as well.
Thank you.
And we want to say again back to the pharmacy staffs, wherever they are, thank you and happy Pharmacy Week.